Every day, roughly 29,000 children under the age of 5 die, mainly from preventable causes. 2 of these causes include a lack of clean and safe sanitation and a lack of access to vaccines. But in order to achieve the world we want by 2030, we need to be serious about health, vaccines, water and sanitation. Just imagine, every time you flush your toilet, your waste is not properly disposed of and might end up back in your drinking water. Right now, 4.5 billion, more than half of the world's population, do not use toilets that separate human waste from contact. In fact, 2.8 billion people use a type of toilet that requires systems like fecal sludge management to treat their waste. Especially in fast-growing urban areas, the issue of how to ensure safe collection, transportation and treatment of fecal sludge has been largely neglected. Last year, almost 1 in 10 infants received no vaccinations at all, leaving 12.9 million infants vulnerable to potentially fatal infections. The world's poorest children are the least likely to have access to vaccines and the most likely to die from a vaccine-preventable disease. And in this globalizing world full of ever-expanding, overcrowded cities, the spread of infectious disease is a huge threat to all lives, all across the world, that must be taken seriously, with experts warning that if we don't increase access to vaccines for these children, a pandemic is imminent. National leaders are stepping up and taking action.
And through our leadership on the high-level panel on water, our government also commits today to ensure the panel champions proper sanitation and waste management services in cities and workplaces around the world.
The United Nations Secretary General and President of the World Bank Group convened the high-level panel on water, where 11 countries are working together to champion a comprehensive, inclusive and collaborative way of developing and managing water resources. 194 countries created a roadmap to prevent millions of deaths through more equitable access to vaccines, called the Global Vaccines Action Plan. These are a few amongst many examples of what is possible when we all work together. So let's ensure that SDGs 3 and 6 are on top of everyone's agenda to improve the health of our future.